Hello everyone, my name is Ann and today I'm going to talk about Rizatriptan, also known as Maxalt. A little bit about patient counseling points. It is used to treat moderate to severe headache for patients who's on oral disintegrating tablets. Do not remove the blister from the pouch until ready to use. Blister pouch should be opened by peeling back, not pushing through foil, and with dry hands. Patients should be instructed to place tablet on tongue and to allow to dissolve. Do not crush, break, or chew the tablets. There are a few common side effects of rizatriptan, such as drowsiness, dizziness, fatigue, heaviness, tightness or pressure in the chest or neck, and nausea. So what is rizatriptan? Rizatriptan belongs to the serotonin 5-HT1 receptor antagonist. It is an anti-migraine agent. For the indication, it is indicated for the acute treatment of migraine with or without aura. So basically, aura is the sensory disturbances that happen before or during migraine. This is how a patient with aura will experience. The picture shows a normal person with a regular vision on the left and a migraine patient with aura on the right. For mechanism of actions of rizatriptan, it binds to the 5-HT1 receptors in cranial arteries, causes vasoconstriction, and reduces steroid inflammation associated with antidromic neuronal transmission. It is basically narrowing blood vessels in the brain, stopping pain signals from being sent to the brain, and blocking the release of certain natural substances that cause pain, nausea, and other symptoms of migraine. Rizatriptan comes in two formulations, regular tablets and disintegrating tablets. They both have 5 mg tablet and 10 mg tablets. The dose recommendations in adult is 5 to 10 mg as a single dose. In children more than 6 years and adolescents, the dose will be 5 mg as a single dose if the patient is less than 40 kg, and the dose will be 10 mg as a single dose if the patient is more than 40 kg. For dose adjustment, there is no renal or hepatic dose adjustment necessary in both adult and pediatric patients for rizatriptan. There are a few warnings and precautions regarding rizatriptan. It increases the risk of myocardial ischemia and or infarction and other adverse cardiac events because of the potential of this class of compounds to cause the coronary vasospasm. Rizatriptan should not be given to patients with documented ischemic or vasospastic coronary artery disease. It can also cause the potentially life-threatening serotonin syndrome, particularly during the combined use with SSRI, for example, fluoxetine, or SNRI, for example, venlafaxine. For monitoring parameters, we should be monitoring headache severity, signs and symptoms suggestive of angina. We also should be monitoring for signs and symptoms of serotonin syndrome, such as hyperreflexia, clonus, hyperthermia, diaphoresis, tremor, autonomic instability, and last but not least, mental status changes. Here is my references. That's the end of the presentation. Thank you.